All right. So you've all heard of the $10 million man, but how about the $10 million Achilles? Jawan James, what happened? So NFL players on contract, Jawan James, hey, I'm working out at the facility, having a good time. And the Players Association decides to tell him, hey, you should go work out at a non-NFL, non-sanctioned facility. Why would anyone tell anyone to do that? I'm not a lawyer, by the way. My credentials, medical doctor, Royal College of Physicians and Surgeons of Canada, and the Fellow of the American Academy of Surgeons in the United States. Board certified, triple board certified. That's me, not a lawyer.
Has anybody ever asked you to do a surgery not at a hospital?
No.
In a garage?
Yeah. It's kind of like asking me as a surgeon to operate at a facility I don't have credentials at, I'm not covered to work at, I don't have malpractice covering me. Well, that's what the Players Association did. They told a NFL player to work at a non-NFL facility. The Players Association, you guys are screwed. So, player works out, Jawan James works out at a non-NFL facility because the Players Association encouraged him to do that. What does that mean? So what does he do? He tears his Achilles. We talked about Achilles. You can look at all my videos about Achilles tendon ruptures, Achilles tendon healing, Achilles tendon repairs. It's a long process. You go through surgery, rehab, or you could go through casting, rehab, proprioception, balance, strength, kinematics, training, mental game back in the sport, but you're not quite 100%. It may take you a year or two before you're back as best as you can, but it's your Achilles heel. Yeah, you can laugh. That was a pun intended.
Are healed Achilles stronger or are they weaker?
Well, it's a good question. So typically, and this is in general, when you look at tissue that is repaired, you get a collagen matrix that on average never gets as strong as what was originally there. So it's about 80% of the strength, but it can go higher because you can reinforce it with sutures, you could add growth factors, you could add various regenerative technology, so you can actually augment it. And oftentimes, when you have an injury, you'll actually rehab and strengthen it, and it'll become more robust and hypertrophied, which may give you the ability to actually get it stronger. Now, it doesn't necessarily mean that the cord is stronger. Imagine a polypropylene braid, right? You have that, it's like a tight rope. You may add more weight on one end and add more people to pull it, but the rope may not actually get stronger. Now in biology, you can reinforce it with suture and add polypropylene or whatever suture material is there and try and give it the strength, but it's really the healed collagen that makes a difference, and everything else synthetic is just superfluous once the tissue is healed. But if you add regenerative technology, patient takes a bunch of calcium, vitamin D, takes some nutrients, changes his whole body health status, and eats healthier and adds more nutrition and vitamins and minerals. So he's actually supplementing. Now, if he had done that without an Achilles tear and supplemented and strengthened and rebuilt himself up, he probably would have been stronger than if he had an injury and then did exactly the same thing. So you have to balance it out. Not everything is equal. You have to compare apples to apples, oranges to oranges, or Achilles to Achilles.
It's a reasonable, Achilles is like a long, because there's like a blood flow issue, there's,
Yeah. And we exactly. And we've talked about it before. There's a watershed area where there's not so much blood supply. You got it to heal. The risk of infection is higher because it's right against the skin on the back. There's also mobility depending on how you repair the Achilles, whether it's percutaneous or whether it's open, and whether you repair the peritoneum separately from the actual tendon. So there's a lot of different factors, whether you got it non-surgical or surgical. So many different factors. And all of that relate that back to the healing. But ultimately, would he have had an injury if the Players Association told him to go to a non-NFL facility? We don't know. That's not the issue. The issue is he injured it at a non-NFL facility because the Players Association told him to, and now he has an injury. So is he covered by workers' comp or the NFL? Don't know. Depends on his contract. So the contract is important. Lawyers get involved. Players Association, what did they tell him to do? Lawyers get involved. They've got lawyers, NFL's got lawyers, and player, you better get a good lawyer. And if you're a professional player or an NCAA player, look at your contract, make sure you only work out and play and follow the rules.